everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Today, we're going to talk about the relationship between asthma and dementia. A lot of us may not put those two together, but personally, I have a lot of interest in this because my mom is an asthmatic, and as many of you know, has been diagnosed with Alzheimer's disease. So there's great research coming out of the University of Wisconsin. Dr. Melissa Rosenkranz joins us now. Melissa, thanks so much for joining us.
No, thanks for inviting me, Deborah. I'm happy to be here.
Okay, so I get like diabetes and Alzheimer's, but what made you think of putting asthma and dementia together? Where is the link there?
Yeah, well, this really, this link occurred to me, I'd say, I don't know, 6 or 7 years ago, because the broader arc of my work is really trying to understand how inflammation in the body impacts the way the brain processes and responds to emotion and cognitive information in terms of increasing risk for mood and anxiety disorders. And because of that, I also follow the animal research, and I was seeing more and more that in animal studies, they were showing that inflammation in the body provokes brain inflammation. And I knew that brain inflammation was one of the things involved in the cascade that leads to Alzheimer's disease and dementia. And I started to get concerned, like if asthma is causing systemic inflammation that is impacting the brain, is it causing inflammation in the brain? And if so, is this potentially a risk factor for dementia? And the reason that that really worried me is because asthma is very prevalent. It affects about 10% of the population. And unlike other chronic inflammatory diseases, it begins usually in the first decade of life. And so most chronic inflammatory diseases like arthritis or irritable bowel syndrome or things like that don't begin until later in life. And so if asthma is beginning in the first decade of life, that means there's a very long window for the damage that can follow neuroinflammation to accumulate. And so that really worried me. And so I started looking for evidence in the data that we had for those connections.
Okay, and so so I presume what you're looking into is how many Alzheimer's, is it strictly Alzheimer's or all different dementias?
It is both. So we just published earlier this year an epidemiological study. The lead author on that was Dr. Christy Bartels, a paper showing that asthma does indeed increase the the risk for Alzheimer's disease in terms of both incidence and prevalence. But not only Alzheimer's disease, all-cause dementia as well.
Right. Okay. So this connection, what did you find? Did you find actually the prevalence of asthma is higher in dementia patients?
Well, we looked at it with asthma predicting new diagnoses of Alzheimer's disease. So we didn't look at it the other way around to see whether Alzheimer's disease could increase the risk of asthma. We looked at it only in the direction of asthma increasing risk for Alzheimer's disease. And we did indeed find that asthma does increase the risk for Alzheimer's disease.
Okay, so it's an interesting connection because of the inflammation, which we all know is not good. All roads with inflammation don't lead to good things, right? But what's interesting too is could it be as well the inflammation caused within the lungs by in asthmatic lungs means they're not getting as much oxygen to the brain. Could that also be a possibility?
It could be a possibility. I think there are several factors that could underlie why asthma is associated with, problems with brain health in general. It could be inflammation, so that's the avenue that we're pursuing most aggressively right now. But it could be hypoxia. Although hypoxia is generally more relevant in people with severe asthma. And we've seen the impacts on the brain, even in people with mild asthma. So their hypoxia probably is less likely to be a big contributor to that. It can be effects on the vasculature, right? Because I have a colleague here at UW named Matt Tattersall who he's a cardiologist, and he has studied the vasculature in children with asthma and has shown that even in children as young as 9 or 10 years old, they have thickening of the carotid artery already. And so if that's happening in the peripheral vasculature, it's probably happening in the brain too. And
Right.
so that could also be a contributor. We're trying to understand more about the mechanisms now, what connects those two things, and they're probably manifold. It's probably not a single pathway.
Okay, I want to ask you a really simple question, which I've thought about but not really understood, admittedly, is how, if you have inflammation in one part of the body, why is that bad for the brain? Like, does inflammation from the lungs go into the brain? What is the
Yeah.
relationship there?
That's a good question, and the answer is yes to both. So there are pathways through which inflammation in the lung can directly signal the brain, like neural pathways. And when you have inflammation in the airway, so if somebody who has asthma gets exposed to their allergen, we're talking mostly about allergic asthma here, and they have an inflammatory response to that allergen, that inflammation from their airway spills out. So it doesn't stay just in their airway. We see increases in inflammatory mediators in their blood, and that is ultimately going to circulate to their brain. And those can bind to the blood-brain barrier, or some areas of the blood-brain barrier are leaky. And so the immune system can get into the brain, and it can signal through the blood-brain barrier into the brain through a variety of mechanisms. So it doesn't just stay in the lung, which I think is more well recognized in other diseases, but in asthma, we still think of it really as a disease that's um, confined to the airways.
So, what do we know though about different types of inflammation? Like, let's say that someone has arthritis, right, which is inflammation of the joints. Are there inflammatory states caused by disease or health conditions that are actually more dangerous to the brain than others, or do we not know that?
That's a really good question, and that's one of the key questions that we're investigating right now. And we think we have some hints about that for asthma. It might differ for different diseases. And I'll give you an example. You brought up rheumatoid arthritis. Rheumatoid arthritis is also associated with an increase in risk for dementia and Alzheimer's disease. And there was a study that was published, I don't know, maybe 5 or 10 years ago, that looked at the Medicare patients who are on Medicare and the medical records of those patients. With rheumatoid arthritis, it was a similar study looking at whether the prevalence of Alzheimer's disease is increased. And the interesting thing about Alzheimer's disease, or the interesting thing about rheumatoid arthritis, is they were way out ahead of other fields in using what are called biologic drugs to treat rheumatoid arthritis, meaning they target specific inflammatory cytokines. And what they found when they looked before and after those drugs hit the market, the people who were on those biologics who were targeting very specific inflammatory pathways in rheumatoid arthritis had rates of Alzheimer's disease below the general population. And the people with rheumatoid arthritis who were not on those drugs had big increases in the prevalence. And specifically in rheumatoid arthritis, it was drugs that blocked a cytokine called tumor necrosis factor alpha. That seems to be, at least in that one study, a really important pathway through which RA confers an increase in risk. For asthma, it might be a different pathway, but that's what we're trying to understand right now.
And how the medications, like if you're taking an anti-inflammatory, perhaps can you stop the inflammation before it gets to the brain? Do we know that?
We don't know that. That's another area that we're actively investigating. We do have a few hints at this because in a lot of this early research, one of the big criticisms of some of our data was, well, how do you know that it's not the medications that are used to treat asthma that are causing problems in the brain as opposed to the asthma itself? And there isn't a lot of data to answer that question right now, but of the data that we do have, it looks like people who use anti-inflammatory medications to treat their asthma, as opposed to only bronchodilators like albuterol, those people, their brain is more protected.
Wow, interesting. We have a question from Sue who says, "Hi, Melissa. I love the work that your center does and the Healthy Minds app. Do you think it could be a combination of the MTHFR gene, mold toxins, or inflammatory diet with stress that leads to dementia? I'm sure that having COVID-19 doesn't help also."
Yeah, thank you for that question. I can't speak to that specific molecular pathway, but I will say that another arm of my research is looking at how psychological stress, changes airway biology, so that if you are exposed to an allergen, that your response to it is different. And we have a few studies now showing that indeed psychological stress primes the lung to respond more aggressively in response to an allergen, an encounter with an allergen. And we have other data that shows that if you train people with asthma in stress reduction techniques like mindfulness-based stress reduction, for example, that can reduce airway inflammation, and it can improve disease control, both of which are important factors, we think, in the impact that asthma has on the brain. And so we have some evidence that just managing your stress well can be protective. In addition, one of the effects that stress has on asthma is it makes the medications that are used to treat asthma less effective. So when people are under chronic stress, their use of inhaled steroids is not as effective at managing their airway inflammation. And so that's going to be bad overall. It's going to be bad for their systemic inflammation. And so if you can manage that stress, it will both help your brain, but it will also make your asthma medications more effective and protect your brain sort of through that route.
Do
So
we
that's a
know?
really great question.
It's so interesting. Do we know that relationship though between why does stress make medication more less effective, and why does it make asthma worse? What's the connection there?
Yeah, you're asking really great questions. It makes it worse through a few different pathways. One is that stress makes a receptor on immune cells called glucocorticoid receptors. Glucocorticoids are stress hormones. Maybe some of the audience is familiar with the term cortisol. That's a stress hormone. Usually glucocorticoids like cortisol suppress inflammation. And that's actually what inhaled corticosteroids are. It's more or less the same thing. But when you are experiencing chronic stress, those receptors on the immune cells become less sensitive. And so they're not responsive anymore to the stress hormones, and they're not responsive to those medications anymore. And so that's one way that stress impacts the inflammatory response in the airway. It also upregulates certain immune pathways that make the glucocorticoid receptor less sensitive. And so it promotes the expansion of T cell populations that are less sensitive to the effects of glucocorticoids.
Yeah,
And
sorry,
sorry, go
go
ahead.
ahead. No, go ahead. Finish.
There's also a route through the sympathetic nervous system where the activation of the sympathetic nervous system promotes the production of new immune cells from your bone marrow. And those new immune cells are hyper responsive to inflammation, and they selectively migrate to the lungs and to the brain. And so you get these new populations of cells that are being produced that are kind of hyper responsive to inflammation.
This is all really fascinating, and it has me thinking just in terms of my own mom. And, she struggled with asthma really a lot of her adult life. So you just think, wow, that could explain things. Um,
Yeah.
What's the next phase of research for to unpack this? I mean, you said you were looking at the asthma risk for people with dementia, and now what's the next phase of this?
What we're really trying to do now is to understand what, like, the nitty gritty, to like dig into the nitty gritty and find out, like, okay, what are the immune pathways that are conferring this risk? And if we target those immune pathways, do we see the changes that we think might be giving rise to some of the neurodegeneration and neuroinflammation? Do we see those pathways not emerging? Um, in some of this work will have to be in animals because you can't do all of this work in people, but to really trying to understand what the signaling pathways are, because if we know that, then they can be targeted with medications to even potentially prevent these effects. Because when you think about asthma beginning in children, that means that there's this long window of time for damage to accumulate, but there's also a long window of opportunity to intervene. And so if we know what we need to target, then we can do that before we have the consequences start to show up in the brain.
So, I mean, I know, we don't obviously want to prescribe anything to people, but is I'm sure a lot of people right now are asking, oh, I'm an asthmatic. What should I do? What should I think about? Is there anything you could kind of say to people from what we know right now? Obviously, there's a lot more we need to know, as we just talked about, but just in terms of what we know right now, how should people be thinking about living their best brain health with a condition like asthma?
Yeah, one thing I do want to emphasize is that these connections that we're identifying, like, this is really new research. So we're not sure that, these things are playing out. So I don't want anybody to like be really afraid, like, oh my gosh, I have asthma, I'm going to get Alzheimer's disease. We just don't have that level of certainty. So I don't want anybody to be really alarmed by this. But what I often tell people when they ask me this question, I say, like, if I had a family member, if my child had asthma, or I had a close family member with asthma, what I would want to do is, first of all, make sure that their airway inflammation was well managed. Make sure that they're taking anti-inflammatory medications for their asthma. Even if it doesn't seem to bother them very much, because there's not always a one-to-one relationship between how you feel, how tight your chest feels, and how much inflammation is present. That's not always a one-to-one relationship. So to really work closely with your doctor to make sure that the airway inflammation is well managed. And the second thing is to really invest in and prioritize your mental health and your ability to manage the stressors in your life, because we know that there is this circular relationship between what's happening, the contents of your mind, and the way that your lung responds in asthma, and then also with the ability of your brain to do its job well. So it's sort of this bi-directional relationship, and you really need to pay attention to both.
Right. I mean, it really just emphasizes the damage that stress can have on your body, right? Looking through another lens. I mean, stress is terrible for our health, whether you have a condition or not. But it's interesting the points you make about how it interacts like a condition like asthma. Um, well, I think what's really interesting is this is putting the spotlight on an inflammatory condition and how it relates to the brain. And that's where we need a lot more research. So, like I am learning from so many researchers that Alzheimer's dementia can come in different ways, right? And so more research needs to go into different areas. So thank you so much for this. I know that Katie has posted on um, meth- uh, the Facebook chat that she has posted where they can find more about your research. So we really appreciate you coming and talking to us.
Yeah, thank you so much for your time.
So if you missed any of this interview, don't forget to go to beingpatient.com and sign up for our newsletter. That's where we tell you about talks like these. Thanks everyone for watching. We really appreciate your time, and let us know what more you want to hear about. See you next time. Bye.